Welcome to the Identifying and Grouping Students module of the Tier 2 Canvas course. In this module, we'll be focusing on systemic problem identification, for our Tier 2 system. We will be covering several objectives in this section. They are listed here for you in this slide. These objectives also mimic those of a school team when they're conducting identifying and grouping of students as part of their Tier 2 system. The first section of identifying and grouping requires that teams build off of evaluation of their Tier 1 system. It's the first consideration to effectively identify students for Tier 2 support, making sure that's at good health of Tier 1. If teams skip that evaluation of Tier 1 health or effectiveness, we will have too many students who are referred for those Tier 2 and 3 supports and then overburden the system or our resources that we have to provide those supports. Evaluation of Tier 1 health also includes looking at subgroups. So on this slide, you'll see some guiding questions we offer you as a team that use data to evaluate how healthy and successful our Tier 1 system is. And some of those questions we're going to address a little bit more as we go into the next couple slides, but you'll notice that the guiding questions cover both that of outcomes of students and fidelity of what we're implementing in Tier 1, such as the benchmarks of quality. In question 3, you will see the guidance around 50% of referrals coming from multiple classrooms. This comes from some of our national guidance on database decision making with school-wide and classroom outcomes. And then in question 6, we'll be addressing a little bit later some of those considerations with Tier 1 specific to the classroom Tier 1 health and resources that can be helpful for teams. So let's go through a little example as far as some of those guiding questions and looking at data. Remember that guidance in Tier 1 health is that if more than 15% of students are needing Tier 2, that's really indicating that it's a Tier 1 health issue, and we may want to revisit the health and work of Tier 1. So in this particular example, this is illustrating something called the core report that's available to you annually in our PBSES system as an active PBS school, or fairly regularly, meaning anytime you want it, in the RTIB data system if your school uses that for student outcome data. In this graph, the green represents the percentage of students on this campus that have had 0 to 1 office discipline referral, meaning that's a low risk or that's a fairly common expected level when we're talking about the outcomes of discipline. That would mean 35% in the yellow are the percentage of students who've had 2 to 5 office discipline referrals. And then of course our red being 6 or more office discipline referrals. So the idea is looking at this data, if this were your school campus, what would your evaluation be of Tier 1 health looking at the outcome of discipline? And if I were to look at this graph and it were my school team, I would definitely want to be revisiting school Tier 1 health, or in other words, I wouldn't feel very confident that we had a really strong Tier 1 in terms of discipline outcomes at this point. Whereas in the next example, you see a lot more confidence looking at the same type of data on a different school campus, where we have a lot of kids in that expected level of 0 to 1 discipline referral versus the one on the left. So in terms of evaluating core, a really simplistic way that teams can do this with discipline outcomes is looking at that core report and looking at how many of our kids are actually achieving in terms of discipline rates at the level we would like to see them doing that. The other thing we just mentioned we'd like you to look at in Tier 1 health to be the most successful and have the most equitable system is looking at those subgroups. So not just looking at overall core like we did in the last example, but unpacking how our health, our Tier 1 is impacting those of our subgroups. So we'll use another example from our PBSES database or data that's also available to an RTIB if your school uses that. And this is the equity profile data that's available on each of your schools in terms of annual data for PBSES. So one way we look at equity is we look at are any more subgroups at risk compared to others on the campus for discipline referrals or out of school suspension. And in this particular example, when you look at it, Black and African American students are in the red there because they are almost 5 times more likely to receive an office discipline referral than other subgroups on this particular campus. So that would be one area. Similar if we move over to OSS risk, that risk ratio also gets pretty high there at 7 times more likely, a little bit over. So that's definitely a subgroup that we want to look at that Tier 1 is not impacting some health for it possibly. The other one up there is our subgroup of students with disabilities. As far as tier 1, they are also presenting with a little bit of elevated risk by a risk ratio of discipline referrals for 2.34 and 2.03. And if you want more information, because this type of data breaking down discipline for equity can be kind of confusing, especially if you're new to looking at this data. So we referenced you to that LiveBinder link in your PDF handouts where you can see some more detailed information of how to interpret this data, as well as some more background on this, where this data comes from. But along with looking at risk ratio, when you're looking at tier 1 health for equity, we encourage you to use the other source of data that is provided for you in that PBSCS system that breaks down not just the risk ratio, but then goes a step further in terms of the average percentage of risk for that population on your campus. So just to walk you through this one, for example, here, if this is our campus and Black African-American students had a 7.4 times more risk for an out-of-school suspension, that graph that it's pointing to shows you that in 17-18, that was 25% of African-American students were impacted by disproportionate discipline. In 18-19, they had a slight improvement on this campus to move to only 18%. But 18% for out-of-school risk is still kind of suggesting that's a tier 1 issue. We might dig in a little bit more and see that there's kids that could be supported better with tier 2 and 3 as well as tier 1. But that's how we use that data to break down is there areas of subgroups that we'd want to target. Just to follow through that example a little bit more, the students with disabilities or students with an IEP, you can see the same information for OSS risk, which you can also see this for ODR risk. We only put up here the OSS risk. But you see that population went from 28% in that graph for 17-18, and they had a big reduction in the amount of that population that was impacted into 18-19. So if I was looking at that data, that suggests we had a lot of improvement between those 2 years. And continuing to look at those who are having disproportionate outcomes with possibly some of our tier 2 or 3 enhanced supports. So just a quick example for how you can look at equity using some of the existing data you do have available to you. And again, to go to that LiveBinder link if you'd like to see more information in interpreting this data. The other area of tier 1 health that we referenced a little bit ago was looking at your classrooms. And a lot of times what we'll see is when students are referred from classrooms, you have to think about if those students are having environments where tier 1 health is present. So if a student's referred for tier 2 supports, but they're spending lots of times in classroom environments with a high rate of problem behavior, or in a classroom environment where appropriate behaviors are not taught regularly and rewarded and recognized, that environment may be something we want to take a look at as contributing to that student's problem behavior, rather than just referring for tier 2 interventions that won't be successful when they're put back in that environment. So in either case, we can't say a student had a poor response to tier 1. We want to take a look at least at the same time that we're providing tier 2 supports, if not doing that first prior to providing. And when we say tier 1 health at a classroom level, we just wanted to offer you or unpack a little bit about what we mean by that. And that's more tier 1 information in our classroom booster that's available through the project. But our big 5 are listed there of 5 essential classroom practices, as well as where you can find more information at that LiveBinder link on these big 5. There are some particular resources that might be helpful to teams like yourselves. We have tip sheets and self-ratings on those big 5 that staff can use to both update and review some of the best practices in tier 1 in a classroom environment. And also to be able to monitor ways that we can improve classrooms that are having more trouble than others. And there are lots of reasons that classrooms can be having trouble, all the way from who's in those classrooms to some of the needs placed there to those basic foundational things that we just reviewed, like teaching those desired expectations, rules, routines, and making sure we provide a high level of acknowledgement and reinforcement to students that are exhibiting those. So just a quick note on those classrooms and some resources to provide to you as a tier 2 team and how you can support that. That link also includes some of the other tools that you've heard probably about before from the project, like the classroom assistance tool that may be helpful to you in supporting classrooms across your campuses. Okay, so after evaluating that tier 1 health and looking at the layers of tier 1 health and supporting that, especially your tier 1 PBIS leadership team is always charged with that work. When we get into the specifics of tier 2, we start with how we identify students or tier 2 after we've ensured that they have that healthy tier 1 access. So this little visual snippet is taken from that tier 1 visual that you saw in the introduction section of the course. But we're starting to prompt the questions in the green here. How do you as a team systemically screen for and identify kids that for tier 2 interventions? And remember, we wanted to encourage this systemically. So we're going to think about what we use to do this, and most specifically using a combination of data sources with something we call applied decision rules to help identify kids effectively and equitably, and then set us up for success with how to group them by common needs and put them in interventions. So in the blue box where you see the arrow here, we're going to cover those 3 little blue boxes or buckets of ways we can identify students. You will naturally probably already use some of these, like existing data. The other 2 that you see there, nomination and social emotional screening tools, may be new methods or methods you've not heard as much about, and we will cover those at the tail end of identification, focused around getting those internalizing concerns identified. So why do we encourage you, and why do we make such a point of you need to use multiple data sources to identify students? And there's many reasons why. We want to make sure that we're not just looking at one or single viewpoints when we're referring students for tier 2 supports. We want to reduce any bias that may be present in adults, and we'll talk about that in a second when they do refer kids. And we want to look at enough information where we can try to get at a motivation or a function of why kids are doing things that they may be referred for tier 2 supports for. I already mentioned we also want to get at not just those externalizing problems, those disruptive behaviors that we can overtly see, but some of those internalizing concerns like worry or withdrawal that may cause us not to participate in class. And we want as much as possible on a school campus to integrate academic and behavior interventions. So when we use multiple sources of data, it helps us look at the combination of academic deficits with behaviors that are occurring. And that chicken or egg question, is it because of academic deficits we're starting to have behaviors, or are behaviors causing some of those academic concerns? And I already mentioned it, but just last little arrow there for you is that we want to make sure internalizing and externalizing are both found. We usually have common methods in our schools that find those externalizing concerns. We are often missing, it's very common that we're missing some of those internalizing concerns or behavioral concerns. So in short, we want to use multiple data sources because it's going to promote the most effective and equitable identification process for us as a school team. So everybody wants that, and that's why we encourage you to think through, and why we're going to unpack each of those multiple data sources that you could use as part of your screening system. So an overcoming bias, we just mentioned that one, and we often start with teacher or parent referrals or family referrals if it's not parents. And adult referrals and catching kids through that method is always a very valued referral, is always a very valued input for our screening system. And we want it to be part of our screening system, but not the only source of identification. And why we say that is there are some considerable limitations to only using teacher or family referrals. And that being, we're almost waiting to fail because we're waiting for them to be caught by someone having that concern. And there can be inequity in only relying on adult referrals. Sometimes some teachers and parents will refer more than others. Some may be highly unlikely to refer based on stigma or misunderstanding what that referral might mean for students. For example, if I mention a concern, does it mean they're going to go straight to being a student with disability or being in a self-contained setting versus I'm referring for just preventative interventions as part of tier 2. And we know some students are more likely to get referred because of demographic variables or symptom type. For example, our boys are often caught much more often than our girls because they tend to have some of those externalizing or disruptive behaviors. And our girls have more of the internalizing behaviors and may tend to be overlooked or not caught as well. We also know that teachers or adults, even families, will sometimes refer less when academic skills are holding steady or not as concerning, even if some of the behaviors are starting to be pretty concerning. For example, those withdrawal behaviors, not participating, not socializing, having friendship trouble. So lots of reasons just to present out of the cons of only relying on a teacher or family referral. We want to be careful with that and balance that with using other data sources and identification. One of the other parts with referrals, we wanted to note the tiered fidelity inventory that you use for tier 2 systems. It has the language of request for assistance. And often people will mean, does that mean my referral? The request for assistance language came from the concern that when we say referral, it means we're handing off a problem in some cases, whereas request for assistance, like the one you see on the screen on the left, is about saying, I need some more help to make this particular student or group of students successful. So we're going to be involving others like yourselves on a problem-solving team to engage in some help or assistance to make them successful. The other on the right that we wanted you to consider to balance out some of that bias or inequitable outcomes that may happen when we rely on only the adults to refer is offering a student self-referral. And right off the bat, we always caution here, of course, that's with our older students. So usually around 4th to 5th grade, students can be pretty accurate at referring themselves and concerns they're having, especially in our middle and high school populations. They can be very accurate at their emotional or behavioral concerns and what impact those are having on them, and maybe more accurate than adults at that age. So including some type of student self-request for assistance is often a really nice method to balance out just the adult referral, particularly again at that 4th and 5th grade and above as part of your screening system. Okay, so in addition to someone requesting that assistance on behalf of the students, we like you to use, and everyone does this in our schools pretty well, use that existing data you have on risk to systemically identify kids for Tier 2. So very similar, right off the bat, you see discipline is one of those existing data sources, and office referrals being one of those. The example we went through with the core report is the next step to this is that we'd like you to think through, when I use existing data, what criteria do I assign to it? So if you remember in that core report, we looked at the desired range being kids who are at that, or percentage of kids that are at 0 to 1 referrals. So if you're getting past 1 referral, that's where you're starting to indicate risk. But any of the data sources you see on here already exist and are present in your data system. So just using that, applying some criteria or thresholds to them to help make sense of what is expected and how are we doing for that for core Tier 1 health versus a data that's starting to signify concern. That's data we can pull on a regular schedule and look for students who are standing out to supplement just the adult referral for assistance or request for assistance or student request for assistance. So that using that existing data is going to be helpful. And one of the methods that we often see schools and districts that are very proficient in doing is that of an early warning systems. So if you haven't seen or read much about early warning systems, this is just one example from Pasco County schools where they've taken some of those early warning indicators that we know from research predicts the likelihood of graduation success. And for each indicator, they've applied some criteria to it. So this is exactly what we mean by using that existing data, but applying some criteria that starts to signify in their system on track, at risk, or off track. And you see they include academic measures like course performance, credits, along with some of those other measures that we mentioned, like attendance, discipline referrals, and some people also include out-of-school suspension here. So when districts and schools are creating their early warning systems, they're going off of research to guide some of those early warning indicators. So if you would like more information on those early warning systems, and particularly the indicators and what has research to predict that success, there's a nice reference there in that link that you can go to from your PDF handout that will give you a little more information on early warning systems and how you can apply that to your indicators and multiple sources of data. And in particular, when you look at existing data, you want to use any data that is suggesting missed instructional time. So this is another example, not as specific as early warning systems, just informally, where teams have taken multiple sources of data and applied criteria to it or set up their statements to which they wanted to establish that criteria. So for example, student had blank consecutive minor classroom reports. Minor being, of course, they're not going to a severity of an office discipline referral. And then students have 2 to 5 ODRs. That's a flag or a significant item of data that's going to flag them for Tier 2 support. So that's one example where this team's just listing out either the criteria and data source they want to look at or establishing that criteria where they can. And some of the things that you may want to consider in addition to that are illustrated in the next example. You want to think of any time they're out of classrooms. For example, this one, even though it looks a little different because they took existing data and put it in that proficient, at risk, high risk, They also here included a lot more data sources in terms of looking at nurse visits down at 10, and that was non-medication related. So they were tracking the number of times they were going to the nurse outside of class, one, that's missing instructional time, and two, we know those type of complaints like physical ailments like stomach aches, headaches, can be a sign of worry or anxiety or stress for students. So it's a nice way to track a data source that already exists, but maybe getting at some of those internalizing concerns. I would always like to caution you, you don't have to have 10 sources like that. That's a lot. But we use this example because it illustrates nicely how they took existing data and applied those decision rules or criteria for a screening system, and then also included, like we said, that missed instructional time. We also have schools that will use things like administrator visits or administrator calls where they have to come out of class, or guidance or school counselor visits. Okay, so the methods we've reviewed thus far are pretty common ones that schools are pretty proficient using, like our referral or request for assistant process, and then using existing data. The next two that were on our original visual we talked about are two methods that may be more new to you or you may not be as fluent as, but we like to highlight them separately because they are specific to trying to build up that we're looking for students with internalizing concerns. Because remember, a lot of the methods we just described are very good at catching our externalizers or kids who are having externalizing concerns, but may miss and not catch some of those with those ones we can't see, like the worry, withdrawal, sadness, anxiety, those type of things. So the first one we like to talk about is the grading teacher nomination process. And before we do that, I wanted to connect back to why we are promoting the idea of looking at internalizing and externalizing. We show this handout or this resource that's listed at the bottom for you in Tier 1 training now as well, but we want you to think about those protective factors that we can establish for overall mental well-being or wellness as we're identifying and intervening at the Tier 2 level, just like we do in Tier 1. So in this particular slide, what you see is across age groups, what we know by setting or by individual fosters protection from a lot of common mental health disorders, or the symptoms, keep the symptoms from progressing to a level of mental health disorder. So in the red right now, you see that of a school campus, some of the most common protective factors of school campuses that we can foster, like healthy peer groups, school engagement, those positive, clear expectations for behavior. And we often connect those to Tier 1 PBIS. We also, though, list for you individuals. So where you see just a little green individual, that's because those are individual factors to us that protect us from developing more of those mental health disorders or from becoming mentally unwell. So when we think of interventions, when we identify kids, we want to make sure we're including methods that identify some of these factors they may need. So for example, in middle childhood, we know following rules is a big protective factor. We usually catch that one no problem with things like our discipline or minor forms or teacher requests for assistance. But that ability to make friends or good peer relationships sometimes is not caught by those methods. So we want to catch some of those skills that are maybe promoting kids to not make good friendships or have good peer relationships. We do that through looking at things for internalizing concerns. Same with adolescents, you see a couple there. So emotional segregation or high self-esteem, I'm going to pull those two out real quick. Those are very common protective factors that we might miss if we just use some of our regular existing data. So with that idea, this is a teacher nomination form. And we have included this format, by the way, before I talk about it, in the resources for this lecture section. We included the teacher and also the grade nomination form. And this format provides teams a way to screen or use a very formalized way to have teachers and grades nominate examples of externalizing, but also those examples of internalizing behaviors. So for example, number 2 on the example up in front of you is diminished social interactions, such as sleeping a lot or not interacting and not participating in games, teased or bullied by peers. It's starting to get at some of those peer relationships that we said were so important. We also see things like withdrawn or avoiding social interactions that could also go to that self-esteem aspect that was listed in protective factors last time that we want to build. So it not only helps us systemically nominate students, but look at both externalizing and internalizing, and they simply start to group in top 3 externalizers and internalizers in this method. So you'll have the teacher nomination form and then go to the next step of the grade, or in secondary, sometimes that's department level of nomination. So it helps the school-wide team prioritize concerns and almost triage by seeing what some of those concerns are in a very systemic nomination format. So as far as the steps that I was covering, each teacher is going to be selecting one on the teacher form up to those top 3 externalizers and internalizers. Then we go to the next step of the grade nomination. So the teacher's the first, and then that progresses to the grade. And then again, these are a little different. Most of the time teams will say, well, how is this different from just the teacher request for assistant? And you're using here a process that's scripted and standardized by these forms to have the nominations come in through a very consistent process. So it's not as open and flexible to anyone to refer for any concerns. It's giving them more of a structure. So you can see these forms again in our resources for lectures section, or also in that live binder link. And nomination process is pretty simple. So we have a lot of schools who will start off the bat with just adding this to their screening process to overcome some of those barriers to only using existing data. Quick staff training, just letting them know we're going to try to do this at least 2 times a year, if not 3. What our decision rules are going to be, that maybe we're only going to apply our top 3 externalizers and top 3 internalizers of the grade are going to be referred for intervention, for example. What is the procedure for teacher? What happens after the nomination is number 3. And then how are we going to let them know after they nominate what's going to happen? We often encourage teams, you're going to set up some nomination decisions. How long after the nomination occurs are we going to provide interventions? The guidance there is usually 10 days. And then how often are we going to then provide that support? So after nominations are provided with 10 days, we hope to start them and provide those, get all their supports in place by 30 days, for example. And also thinking about how we're going to notify families that that child's nominated. The other method that we want teams to consider, and is probably the strongest method in the field for catching students who may have internalizing concerns, along with combining that with other data sources on the campus that we've already reviewed, is that of a universal social emotional formalized screener tool or measure. So one thing to know about this is that before even starting to use some of these tools, there's a lot of consideration that goes into selection and planning. There are a lot of good screening tools that can be used for this purpose, but they're going to be guided by bigger things to your screening system, like policies and procedures, and selecting tools that abide by some of the bullets you see there that follow what we can afford for resources with cost, time, feasibility. But teams select to use these to add what you see under utility there. So it's going to tell you more information. It's going to provide more direct information to use for guiding interventions, and will also allow you to look at broader outcomes for students in terms of internalizing and externalizing. But you always want to be using tools that are research-based. That means they're valid. They're meant to measure what they're intended to measure, and they're reliable. They measure that same thing over time for your age, demographic, and setting. And because selection and use of a social emotional screening tool could be a whole nother day, we are leaving you with some very good resources and a universal screening resources little highlight of this section of the lecture. So that same resources for lecture section, under universal screening resources. But some examples of those resources up above is some example tools that you may have heard of, the best being by the Basque company. That's a universal social emotional screening system for pre-K through 12. And then you see some other measures that are listed because they have that reliability and validity, are known to be strong tools for what they're intended to do. Below that, we are going to provide you some of these links and tools also in that resources for lecture section. But these will provide you with some list of actual tools in addition to 5 listed here, and give you some guidance on how to plan out your decision rules around screening systems. So the top being that link there that will give you the most up-to-date information on any measures that are available, because that field changes fairly rapidly. We give you these tools because we'd like you as a team, when you do want to add in a social emotional screener, there are certain considerations that you'll want to go through. And so this modeled example using the strength and difficulties questionnaire, it models through what we mean by using these questions to guide selection and planning. What grade level is it targeted to? If you're looking at a lot of tools that you want to consider, you want to know what's your age group. So the STQ, for example, is used by lots of schools and districts because it goes a wide age range. It goes all the way from pre-K up to high school. What concerns does it look at? So the SDQ looks at both negative or risk factors of overall social emotional health, to also a strength, that protective factor of mental health or mental wellness or social emotional health. So peer relationship problems is the strength or protective factor it looks at. And that's why we added the question for you. Does it look at those resiliency or protective factors? And this one does. It looks at pro-social behavior, friendships. And then you want to know who can complete the tool. So some of these measures are going to be teacher reported or teacher rated. And so with those, you definitely want to know how long, and you see that in how much time does the measure take. There are also items where the students can self-assess. So for example, this one you see in who may complete the tool, students ages 11 to 17 can self-report on this tool. And that's nice because in adolescence, we'd rather have the students self-report, as we mentioned earlier, that can be very accurate at reporting their levels of difficulty and perception of difficulties that they're having. But we'd want to think about that if we want a measure that does both. And then, of course, this one's free. That's why it's another reason it's used a lot. We also ask about computer-based scoring and data-based decision-making tools that come with it. And last but not least, a lot of times we want to know, does it come with, just like our academic screeners often come with a matched instructional tool or intervention list. Some of the items or some of the tools do and some of them don't. So again, those resources that will allow you to answer these questions will be included in the Universal Screening Resources section of this module and right after this lecture. We will leave you with universal screening just because the screening tools can be used universally or they can be used for individual students. The pro of a universal screening is illustrated through this example, and this particular screener used is the BIMAS. And when you see, this is the little data template or scoring software that comes with this particular tool. And this is a grade level report. So if I'm universally, meaning I'm screening all kids in a grade, even though that seems a little scary to take on in some cases, it allows me at the grade to see that tier 1 health and also then identify for kids who may need tier 2 and 3 supports at the same time. And I'm just going to walk through one example. So the scales that this tool measures, the risk are on the left and the strengths are on the right. So if we look at a risk scale like negative affect here, which is the internalizing measure, we had about 63% of our students in that low risk range. So remember, when we get tier 1 health, 63% at our desired range for a risk definitely leaves us some room as a team where we might look at ways to build or overcome negative affect at a tier 1 level, while also looking at students who are in that high risk range that we may be looking at tier 2 or 3 supports for. So for example, if they use this screener and we saw that at risk for negative affect, which is withdrawal and sadness, we might implement routines at that tier 1 level that benefit well-being and happiness for all students, as well as some adults in some of the interventions, like using gratitude journaling routines as part of our routines that we use across the campus. Gratitude journaling is known to foster positive emotions of both kids that use it and adults that use it. So simplistic ways that sometimes universally using these screening tools allows us to make a little better decisions than just using them individually. So as we end with how to identify, the key to identification is on how we are able to then group by similar needs. So that will be the next session that we talk about. But we want to end with, we've systemically identified kids through these methods, and now we have groups of concerns for behavior externalizing only, emotional or internalizing only, or a combo. We have both of those kids who have behavioral and emotional and concern with some academic deficits. We're also going to look at how to do this by function. So thinking of, are they trying to get something or get away from something to match our interventions? And keeping in mind groups of students by instructional need, such as anger management or kids who need assistance with organization. So the scope and why we spend so much time on identification is to help set us up for grouping by common needs. And the last thing is any of the methods that we covered in this section, we present all of them as options to you, but you have to think about the resources you have in your schools and your school campus that you are listening and participating to this course to help. You only have so many resources. So considering the timing, scheduling out the measures that we're going to use, if we're using existing data, using it quarterly, for example. If we're going to try a nomination process, when are we going to use that? We might time it when we're going to run existing data, like at the end of a quarter again. If we're going to use a universal screener or an individualized screener when we do that. And then always thinking through what data can we collect and pull. So you saw Pasco's early warning system example. They have a data collection system that allows them to look at that data fairly regularly. I know some of my districts, when they look at that data, use something like Performance Matters and a baseball card feature where they can look at the indicators all together. So these are just the logistics of, as you think about those methods, what can you feasibly do on your campus with success? And then last but not least is applying that decision rule of what's the criteria to each measure that we're using. Academic measures and those social emotional screening tools that we just mentioned, they will provide you those, but discipline and attendance and some of the other indicators, nurse visits, you'll have to develop that criteria as a team. And then don't forget about your district policies. A lot of districts provide some of that guidance in their MTSS process and procedures. So those can help you out as school teams. So following up with your district coordinator to possibly ask about anything that may help you there. So that is going to wrap up the identification section. And next we will be going into grouping, and we will cover grouping by common needs as part of starting with interventions or delivering evidence-based interventions.